But staying now with the state capitol, session might be 4 months away, but new legislation is already being introduced. One new bill would expand access to health coverage in New York by creating a new buy-in option for the state's essential plan. That's the least expensive plan offered on the state's marketplace, and it offers everything you would expect from your health insurance, like doctor's visits to emergency care. And it's pretty popular. Almost 1 million New Yorkers are on the essential plan right now, according to the state. But almost just as many New Yorkers that we know about do not have health insurance. At the same time, insurance premiums in New York are higher than most other states. So even people who have insurance might struggle to afford it. That's where the new bill comes in. For more on that, I spoke with the bill's sponsor, State Senator Jeremy Cooney, a Democrat from Rochester. Senator Cooney, thank you so much for coming back. I appreciate it.
Glad to be here.
Thank you. So you have written this bill. It's basically an effort to expand coverage under health insurance under the state's basic health program, which is also called the Essential Plan for those that are confused about why those two things may be called different things. You describe it as something that people could buy into. Can you tell me how that would work under the legislation you're proposing?
Absolutely. Like some other piece of legislation, you're talking about redesigning the entire healthcare system. That's not what my legislation focuses on.
Right.
My legislation focuses on health insurance and being able to buy a different type of insurance, even if you're already in the private market. So we know from feedback from New Yorkers that there are a lot of positive comments with New Yorkers who have access to Medicare, Medicaid, or Child Health Plus. If you do not have eligibility for one of those programs, you have the ability to be part of the New York Essential Plan if your household income is below 200% of the federal poverty level. What our legislation does is just opens that up to more New Yorkers. Oftentimes when we talk about health insurance, we're talking about premiums and co-pays. But what we often forget about are those pesky deductibles. So a lot of New Yorkers have health insurance. They have coverage, but they can't afford to use it because their deductible is so darn high. And so if we're able to get rid of the deductible, we hopefully will see more New Yorkers take part in preventative health care, meaning they get to go see their doctors. They get tests done on a more timely basis. They can afford their prescription drugs, all the things that we want for a more healthy state. So that's what the Essential Plan offers. And our legislation just opens the door to allow more New Yorkers to buy into that if that's their choice.
Now, is this designed more for people who literally can't afford health insurance right now and are uninsured, or is this designed more for people who have health insurance now and want a more affordable option, or is it both?
A little bit of both, but I would say it's more for those who currently are unsatisfied with their health insurance product. So for those New Yorkers who are paying thousands of dollars just to have a health care plan, but aren't able to access the benefits, this might be an alternative for them. You know, we talk about healthcare for all and healthcare is a human right. We hear those expressions a lot in the legislature. This allows people, New Yorkers, to utilize their healthcare benefits. And ultimately, that will lead to a healthier state.
Is there any sense of average savings by somebody who might sign up for this instead of another plan on the marketplace, or maybe even a plan that their employer offers? Is there any sense of the cost part of this in terms of the individual?
It's a little bit tricky because it's done by household income.
Right.
So it really depends on your unique set of circumstances. But I can tell you that the average New Yorker spends over $5,000 per year in deductibles, co-pays, premiums before they really see that healthcare benefit. So again, we're moving the conversation from just talking about healthcare coverage to talking about accessing the benefits of the healthcare plan. And I think it's less risky or less, scary than blowing up the whole healthcare system and going to a new model. Now, listen, I want to be very clear. I still support the Campaign for New York Health and the New York Health Act. I'm a co-sponsor of the legislation. But I've been frustrated as a legislator, especially a new legislator, coming to Albany and having the same conversation and never really seeing a change in our health insurance marketplace. So for the New Yorkers who are struggling with high healthcare bills, we need to move the dial in the right direction. We need to lower costs and allow them to use their access. My legislation doesn't fundamentally change our healthcare system, but it provides another option for families to choose from if it helps lower their costs.
Now, what about the cost to the state from this? The essential plan is partly subsidized by the state. That's why the cost of it is so low for people and so affordable. How do you deal with the cost of legislation like this? And do you have an estimated cost that the state might cover?
Well, two things. One, it still is a cost that's borne by the consumer themselves. So the New Yorker who chooses to buy in to the New York Essential Plan based on their household income would have a premium that they would have to pay and be responsible for, just like if you were staying in the private insurance market. There would also be costs that would be borne by the local health agencies or hospital systems, depending on where you are in New York. And we recognize that that is going to be an increased cost at the local level. That said, we have learned our lesson from the pandemic, knowing that a lot of our hospitals really struggled coming out of the pandemic to make sure that they had a balanced budget, especially our safety net hospitals, which focus in on vulnerable communities, Black and Brown communities, English as second language, low-income communities. So we want to make sure, and we wrote this into the legislation, that they are not punished because they're serving more people who may be on the New York Essential Plan. So we've already kind of worked that out in the legislation for our safety net hospitals specifically. But yes, this does mean that some hospital CEOs will make a little less money. This does mean that it will cost a little bit more at the local level. But I like to focus on the bigger picture, which is that we are preventing some of the catastrophic costs that are very high for our local hospital systems by preventing New Yorkers from ending up in the emergency department. Let's prevent them from getting there by making sure that we're addressing things like high blood pressure and diabetes early on through preventative and regular medicine and care.
I was just going to mention that the cost savings could also come from that preventative care. It's often in New York, we see such high medical costs because of the burdens that are placed on hospitals because of people who don't happen to have insurance. So it's a really interesting bill, really interesting concept. We will see where it goes in this next legislative session. Senator Jeremy Cooney, thank you so much.
Thank you for having me.